Hello everyone, I am Dr. Ashritha. I am consultant Pediatric Hepatology and Liver Transplant in the Department of Integrated Liver Care and Pediatrics from Aster CMI Hospital, Hebbal. So today I will be giving insights into common pediatric liver diseases. So in pediatrics as against adults, there is a wide spectrum of disease which can affect a child. So it can vary anything from a genetic disorder or a metabolic disorder, what we call, to infections as well as recent epidemic, that is metabolic dysfunction associated steatotic liver disease or the fatty liver. So why it becomes important to diagnose these disorders is because we can treat most of the pediatric disorders either by medicines or, if it's not possible, by liver transplantation. What are the common signs and symptoms is that mainly because the liver is involved, they can present with jaundice, they can present with generalized itching, they can present with blood in vomiting or blood in the stools, or they can present with distension of the tummy because of water, or other non-specific things like weight loss, weakness, and certain alteration in sensorium. So before the treatment, what becomes important is the preventive measures, and that is extremely important for genetic disorders as well as for the fatty liver disease. So genetic disorders, how we can prevent? Obviously in the child who has already had the disease, we cannot prevent, but in the siblings, with respect to genetic counseling, etc., we can definitely prevent another child being born with the same genetic disease. Second, with respect to fatty liver disease, because the main cause of fatty liver is our lifestyle. That is, nowadays we don't exercise much, we eat all random things and junk foods, and because of which we actually tend to have this problem of fatty liver. So what we can do best is modify our lifestyle, that is, have a balanced diet. We should have more of fiber intake, less of processed foods, and totally avoid processed foods and beverages if possible. Second will be the exercise. So at least 5 days a week, we are supposed to exercise at least 40 minutes per day, and this is applicable even for children. So we have to push them more to go into sports and other physical activities instead of having a lot of screen time. So the other aspect is vaccination. So there are many vaccines which can help prevent occurrence of a liver disease like hepatitis A and hepatitis B, which is given in childhood, and it almost offers lifelong protection from these diseases. So apart from vaccination, balanced diet and physical activity, what becomes more important is a regular health checkup. So even if the child does not have any diseases or any symptoms of an underlying disease, having a regular health checkup like once in 6 months or 1 year, you can just show it to your pediatrician, and they'll be able to pick up the subtle signs and symptoms of an underlying disease and will help a child from developing a serious disorder. Thank you.